Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, dealing with pain is a pain. We'll offer comforting counsel on how to stand up to pain. Then, police and fire workers face changing retirement and healthcare options. We'll help our safety workers make the safest selections. Do you know an outstanding senior volunteer? Find out how to volunteer them for well-earned recognition. Plus, are your craft tools too tough to handle? We've got designs on some easy-to-manage options and why your auto insurance may not protect you.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. When it comes to back pain, Dr. Samuel Rosenberg says a one-size treatment does not fit all, and he's here to help you pinpoint the proper plan for deleting your pain. Dr. Rosenberg is with the Spine Center at Metro Health with a clinical focus in pain management. Welcome to the show. Welcome.
Thank you.
Will all of us have to deal with back pain eventually? Is that what we all have to look forward to?
I think most commonly the people at some point in their lives will develop back pain.
All right, so it's kind of an inevitable thing. So should we be doing exercises or doing anything to try to avoid it or at least make it not so bad?
I think there's some conditions that are part of wear and tear. Some rare conditions, people are born with pathology that may not give you any problems until later on in life, like narrowing of the canal. But most commonly is wear and tear. So when the people come to me and they're angry as to why it happened to them since they exercise, I tell them because you're lucky. And when they say, what do you mean? I say, because you're alive. Only the dead people don't get back pain.
Oh,
so
no.
Most commonly, sooner or later, all of us will develop back pain. Not necessarily will need to be treated. Most commonly, the back pain goes away. Most commonly, it's not dangerous.
Okay. So I know you advocate a diagnosis. If you're having back pain, you need to find out what's going on, correct?
Correct. So even though I told you that most commonly back pain is not dangerous, there are some conditions in which it may lead to things that may need to be treated right away. So if the people are having progressively getting weaker in the legs, or in the case of the neck, progressively weaker in the arms, or progressively number in the legs or arms, they immediately need to see a medical doctor, preferably a specialist, so they'll get the right diagnosis right away. Okay. But most commonly, people don't have progressive weakness or numbness in the legs or arms.
Okay. So when somebody comes to see you and they have back pain that's getting to the point where they just have to do something about it, how do you make that diagnosis as to what's going on?
I need to, first of all, take a good history, which is probably the most important thing is history taking, and that would lead me to think of the back pain being caused by A, B, or C. Mm-hmm. Then I need to examine them, and finally I need to include diagnostic modalities such as X-rays and MRIs, and less preferably so CAT scans of the back to work up their pain. Mm-hmm. So the X-rays will determine if people have fractures of the bones, misalignment, or disc degeneration. The MRI will see what's inside of the spinal sac, inside of the canal, the discs better, and CAT scan will see much better bone than MRI, but the problem with CAT scan is that you get radiated while getting a CAT scan, which does not happen when you have MRIs.
Okay. So once you've diagnosed a back problem, then there are treatment options? Is it exercise or therapy, or what do you usually work with people on?
So basically, there's a whole modality of things that we can offer patients. For the very acute patient, the one that cannot move, cannot walk, then obviously they need to be seen. But people commonly get a short dose of steroids, which if you take it just for 5 or 6 days should not cause any great difficulty of any kind. You can take anti-inflammatories, muscle relaxants, and for the short-term pain medications as well. Mm-hmm. The key is to understand what the source of the pain is. If you have somebody with chronic pain, the question again is, what is the cause of the pain? So that people can come for different diagnostic purposes, again, for different workups with all these modalities that I told you. Sometimes people need EMGs, EMGs, electromyograms, nerve conduction studies. And other times people need nerve blocks, spinal blocks, to pinpoint what the right diagnosis is, where's the pain coming from.
A lot to it. I understand there's a program coming up that you're going to be speaking at if people want more information.
Well, I'll be speaking March 20th at 6 o'clock at the Marriott in 150th, West 150th.
Okay.
So it's a Thursday evening, and I'll be happy to give people a few tips on what to do with their pain.
Excellent, excellent, because there's a lot to this, I can see. The best treatment for back pain, the one that is tailored to you and your particular spine issues. Follow Dr. Rosenberg's advice and see a spine specialist. Need help in finding one? Use the information that's coming up next.
Find out more by calling Metro Health at 216-778-7800 or log on to www.metrohealth.org. Next, alarming changes for safety workers.